The topic for this round is, how can Farm Bureau build upon collaborative relationships such as Farmtown Strong to combat nationwide crisis, such as opioid dependence, addiction, and mental health issues? The contestants for this round are Billy Ogdahl, Katie Skaliski, Sheridan Visser, and Chris Gardner. We will begin this discussion with 30-second opening statements from each contestant. Follow the opening statements will be 15 minutes of open discussion, followed by 1 minute of quiet time for the contestants to prepare their 1-minute closing statement. Contestants, you may now in voluntary order make your 30-second opening statements. Please stand and direct your opening statements to the audience. The timekeeper will indicate when your 30 seconds is up.
Farming and ranching has been extremely difficult in these past few years. Multiple variables have caused low prices, affecting our profits. Weather conditions have made it extremely tough to care for our livelihood and our livestock and crops. Many farmers and ranchers feel all of this stress and unfortunately have turned to detrimental ways of coping with this stress called opioids. The opioid epidemic has caused so much problems that even in the state of North Dakota, 90% of our counties are classified as.
I believe that the collaborative effort to form Farmtown Strong is a great start in attacking the opioid epidemic. All the resources that one would need in a moment of distress is on the Farmtown Strong website. However, I think that we need to shift our focus into educating the public as to what the resources are and why they're important. I think that outreach in public schools and having community forums to inform the public about warning signs and focus on prevention is the best step moving forward.
Opioid addiction and mental health issues are a silent but very real crisis in rural America. The lack of treatment, resources, and support only increases these issues, and the negative stigma surrounding it makes it hard for farmers and ranchers to be able to talk about it. I look forward to discussing this issue and finding solutions to this epidemic together.
The opioid epidemic is talked about in many of the city areas all across our country. However, one that's neglected is our rural communities. I look forward to discussing some possible solutions to these opioid and mental health illnesses, and I look forward to finding some solutions with you all today.
You have heard the opening statements. The contestants may now proceed with the discussion. Contestants, please direct your discussion towards your fellow panel members.
So I think that when you first approach a problem this serious, you really need to focus on the humanitarian aspect of it. We all know somebody, I'm sure that we all have an experience, have a family member, have a loved neighbor who's struggling with something. You know, stress, like you touched on, Billy, stress is just, in the past it's been just treated as, you know, it's just a part of the job. Agriculture is stressful for everyone. You know, why can't you handle it as well as, you know, so-and-so did? Oh, that's just a toxic way of looking at it. We need to really be empathetic towards our neighbors and really recognize that nobody's immune to this epidemic. It's very real and it affects rural communities more than anybody else. Katie, what can you add to that?
I think that's a great point you bring up. There is kind of a lack of almost communication between farmers and their neighbors or anyone else in the rural community. So kind of bringing those resources closer to them, whether it be finding more organizations that are close to home to them, because you think of kind of opioids and drugs and everything like that in those higher city populations. And one example of a state that's very close to us that's kind of making a difference is Minnesota. So their Farm Bureau is also partnering kind of with that Farmtown Strong, and they have that higher population of their state compared to North Dakota, and they've made some great advancements that I think that we should kind of model after. So Billy, do you have any kind of other suggestions of how we can maybe make an example out of them? Or
So yes, thank you very much, Katie. So I would say that first we should look at the example that we have right in front of us, which is Farmtown Strong. which is a collaborative effort with North Dakota Farm Bureau and the National Farmers Union Organization. So that in itself shows us that we're able to actually leave our differences aside to combat this nationwide epidemic on a united front. There's another thing that I would like to highlight too, and I'd love your opinion, Sheraton. There is a collaborative effort called Strengthen the Heartland, which is from SDSU and NDSU. So that is another way where we can use that to really try and garner grassroots active support from North Dakota Farm Bureau members.
Billy, I like what you said there and how you all brought this in. I think something to focus on is this negative stigma around drug users. We understand there's that negative stigma around it, and opioid addiction isn't always a druggie in that sense. It could be somebody, it could be your grandpa, somebody's uncle, either priest or preacher down the road that came out of a surgery, was prescribed opioids, and unfortunately got an addiction off of it, but they're too scared to talk about it because of that stigma. I think it's important that when we talk about it, we break it down not by an addiction or by a drug user, but by the brand in which they got to where they are, so we can understand where they came from and that it's a more accepted thing to talk about, that they can go get help. And then with Farm Bureau, we needed to give them those opportunities, especially through Farmtown Strong, where they have resources to go to and they understand they are still accepted.
I think you bring up a great point, Sheridan. I guess one question I have for you is, what else do you think that we should add as North Dakota Farm Bureau members to Farmtown Strong to kind of make it that better connection with the farmers and kind of close that stigma that is out there with mental illness?
I think that's very important. I'd like to partner not just the stigma, but also getting into rural communities and being a solution too. I, as a first responder, know that it's very important to have Narcan training in rural communities. Whenever first responders go in, they're also in danger if they go into an opioid overdose situation. So I think Farm Bureau could definitely step in there and have education and maybe financial support to giving education to Narcan training for first responders, for community activists, for anybody who may come across those, maybe counselors, anybody that is going to be in contact with somebody that may have gone past the point to overdose.
And I would add to that, going back to the Strengthen the Heartland program that I brought up earlier, that is actually a perfect vehicle for exactly what you described. What it would allow us to do is Farm Bureau, as a grassroots organization, we can have local young farmers and ranchers at either the county, district, or even state levels actually become certified. Now, they will be there as a liaison to help with the opioid epidemic in any way that they can, but they actually will also get paid to go through this training. So that's one way that I think North Dakota Farm Bureau could really utilize, again, coming together on a united front between North Dakota and South Dakota.
I like what you said there, Billy, and also to bring Farm Bureau into it, we have membership benefits, and I think bringing in the mental health side, one benefit possibly we could add to members or insureds under NODAC, maybe like 3 free counseling sessions that they have access to, so they don't have to initiate where to find a counselor, who they should talk to. They know that automatically they have 3 free counseling sessions that they can go to, and then that'll help them lead into deeper help where they may need it.
And bringing Farm Bureau into it, like you suggested, currently there's no policy that is either at the local, at the state level or national level that deals with mental health. So that would be something that we could do this year, at least to make sure that we put it on the books so that Farm Bureau can have a stance there. Chris, do you have anything that you'd like to add in regards to that?
Yeah, thanks, Billy. I absolutely agree that Farm Bureau needs to take a resolution stance. They need to get it in writing. This is where we stand on it. This is an issue to us. These are our neighbors. These are our families. This is who we are. We live with the risks every day, and we need to take measures to protect our members. So I really like the idea of the free counseling sessions. I think that, like you mentioned, the stigma, I think a lot of people just feel hopeless and they feel ashamed when they're experiencing these kind of struggles. I think a lot of them feel like they're becoming a failure because they're not feeling the right way. And that's just something that we need to attack. I think that placing information, like you said, people could become liaisons. We need more local people in these communities that are trusted by their neighbors. Because if a producer is struggling, they're not going to call up some stranger and start dishing about their feelings. It's just not realistic. What they need to do is they need to have people available that they trust, their neighbors. Maybe it's a niece or a cousin, somebody that went through the training program and with the best interest at heart of helping improve the mental health of their communities. So what do you think you can add to that, Katie?
Yeah, I think that's a great point you bring up. I think one of the burning questions that I have kind of going through my head right now is mental stigma or mental health stigma and everything that's going around has just become a very popular topic. It's been around forever, but no one likes to talk about it just because of that stigma. So I guess a question I have for you, Billy, is how can we as North Dakota Farm Bureau make sure that this stays a relevant topic? And I know you talked about more policies added to the book and everything, but just make sure that, yes, we had a really tough year, but if next year's great, there's still that stigma out there. So how can we make sure that we're still making this a part of the conversation, even if we have a great year?
Thank you, Katie. I would love to visit the point that Chair Tim made right in her opening statement about reducing the stigma. I think that unfortunately, there's a thing called small town gossip. And what we find ourselves battling in rural America is if I have a problem, you guys may know about it before my family does. And I think if we can really work to, honestly, it would be an educational thing, and it would be people, young leaders like us, young farmers and ranchers, and Farm Bureau members that just start that conversation and really let everyone know that it's all right and we're going to address it, and look at the team that we have with us, just like Farmtown Strong, collaborative efforts, and just keep building on that momentum.
I think that's a great point you bring up. And another question I have, maybe Chris, you can join in on this. What do you think would be kind of some preventatives that we could bring into the topics with these farmers about, yes, maybe they get injured, but what are some things that could be used as preventatives so they don't have to fall back on those opioids or fall into kind of that mental health struggle? What are some things that we can kind of talk to them about that can help them so they don't have to get to that point?
So focusing on prevention. I think that's the most effective way of moving forward. If the problem doesn't have a chance to materialize, then it's a lot easier to control. I think that reaching out to schools, local schools, high schools, middle schools, and maybe even down to the elementary level, it needs to be normalized. These conversations, they can't continue to be this hard and so difficult to start. I know it's not always easy, it's very, very rarely easy to open up about your feelings, even to people that you trust, even to family members, trusted neighbors. I think that we need to do a very comprehensive plan of educating our youth. They need to know what the warning signs are. They need to be able to see that, maybe their parents aren't okay. And a lot of times, when kids are growing up, they view their parents as, like they're perfect. They're the model. They're the biggest role models in your life. They're not always okay, and for some people, it takes a long time to realize that. Warning signs need to be more common knowledge, is what I'm saying. So, what do you think you can add to that, Sharon?
I really appreciate you bringing that up, Chris. So, as far as warning signs go, I know coming into this year economically, it was looking very difficult. And between my organization of Farm Credit of Mandan and also I saw NDSU Extension, there was flyers and pamphlets, and there was a message going out that basically said, it's a hard year, do you need help? Reach out, get help. And I think that's great that these farming organizations bring that out. And I think that's a message that Farm Bureau can continue year after year, not just when the economy looks bad, not when the times look hard, but we can normalize it and always have those resources at the forefront of what we're talking about, because people are always having a hard time. Mental health issues are always big, not just during the economical times. But I think a step further we can take is making sure that our ag workers out in the industry, the faces that our farmers and ranchers see, whether it is your crop insurance agent, whether it is your extension agent or your banker or your loan officer, give them some proper training to see the signs and symptoms and how they can intervene and help or even prevent and provide community support to anybody that may be struggling with it. Katie, how do you have to add to that?
Yeah, I guess I kind of like to go back to Chris's point about bringing it in and talking, and Billy, you talked about this too, just talking about it with the younger generations, just getting it in their head before they have to kind of grow up, get in those difficult situations where they have a hard year farming or ranching, and they feel like they have to go back to those kind of opioids or any other drugs. So I just want to ask Chris, I know you talked about kind of bringing it into the classroom. I know with living in ag in the classroom, do you think that could be something that could be kind of incorporated into their lesson plans or their curriculum, that mental health could be talked about in that?
Yeah, so I think as a part of any difficult business, I think stress relief should be a big part of it. Just knowing, when you need to take some personal time, not letting work dominate your life, really. I think that should be more common in, not just agriculture, but business in general. But obviously, we're highlighting the problem in rural areas. So, stress relief, just reaching out for mental health professionals. When they have access to it, hopefully we can get it more accessible, but I definitely think that it should be a part of the curriculum in the classroom. Stress relief, the parts of managing a healthy balance between your personal life and your work life, because too much time working on stressful projects is not good for your mental health, and I think that's very plain to see. Well, what do you think, Billy?
I'd like to go back and just build upon Sheraton's point about resources and how important resources are. I would say that the most important resource is people. And currently, 90% of the counties in North Dakota are considered a medical professional. They do not have enough medical professional staff on hand. So what we can do is we can use Young Farmers and Ranchers, our P&E committee. We can be involved in this from the ground up, and we need to have people there, and North Dakota Farm Bureau needs to take a more direct role in trying to really use us and really try to push that forward.
I think that's a great point you bring up, Billy. Just going back to kind of the certification you talked about before, and even like bringing in the classroom promotions and everything that we've talked about are just strong points that we can kind of do as North Dakota Farm Bureau members to kind of incorporate into our mission and what we're here for. Because this epidemic and all this mental illness stigma is huge, and I don't think that we've even addressed it enough at this point.
And again, I would say we haven't addressed it enough because nobody wants to talk about it.
Yes.
And it's going to come from the grassroots leadership, which is just like us here, everybody here that has been so actively involved in North Dakota Farm Bureau.
Absolutely.
I think we can all appreciate Farm Bureau too, with the network and the community, and I think even just promoting these events and this fellowship in this community, when you're surrounded by people that you know that care about you, you're less likely to go downhill. You have people, you have a safety net. And I think even what we're doing is good. We got to give that credit, and just to bring people in and give them this community, because these are good people, and this is something to share.
Time has been called. Please prepare your closing statements. I ask that the audience remain silent for 1 minute to aid the contestants in their preparations. Please put down your pens. In voluntary order, please stand and give your 1 minute closing statements.
Well, thank you everyone for this great discussion today. I think we touched on a lot of strong points that can be talked about and even incorporated into our North Dakota Farm Bureau mission. So kind of adding to those classroom promotions, talking about that mental health stigma and the opioid epidemic, bringing in that certification aspect, that could be included in our membership, and everything else that we've kind of pointed on, I think are great things. And yes, we did have a poor year, but remembering, the number one thing I think is remembering that we have to keep this conversation moving, even on the good years when we all find success. So thank you everyone for this great discussion today.
Failure is an event, not a person. I think that in the tough times, we as agriculturalists need to remember this. I think that we had a very productive conversation today, and I'm really proud of all the great ideas that we bounced off of each other here. I think that we need to lean on each other more. We are our greatest resources, like Billy said. I really like that statement. We can put a grassroots effort forth, and we can help each other. We can get the certification. We can help each other when we need it. And we have all the access to each other that we need. We just need to know how to get the gears moving. Thank you.
These issues start close to home. So we, as North Dakota Farm Bureau, need to be close to that door of that home. And the way to do that is with people. I wanted to thank you guys for a wonderful discussion today. I would challenge us all to move away from here and think about trying to enact perhaps some policy at the district level. And I'd also like to try and really, with our recruitment, we can use this as a selling point because so many North Dakotans are directly affected by this nationwide epidemic.
74% of farmers and farm workers say they have either seen or been personally affected by the opioid crisis. I think what we really pointed out here today is that it's going to take a community, it's going to take an increase of resources, treatment, and support, whether it's through Farmtown Strong, whether it's at the local level, whether it's going into your local fire departments and providing that they have the Narcan training and the Narcan resources that they need, and also to provide those membership benefits, such as the 3 free counseling sessions, so they know they're supported and they know there is treatment and we're there to back them up. I really enjoyed today. Thank you for your great topics and your great discussion, and I hope we can continue with the solutions to this epidemic.
Let's show them our appreciation.